The following segment deals with women's health and may not be suitable for all ages. Parental discretion is advised. Well, today on the show we're at the Hancock Women's Center talking to Dr. Noelle Duplanchet. How are you?
Good. Nice to meet you.
Nice to meet you. Now, tell us, if you would, please, a little background about yourself.
My name is Noelle Duplanchet. I've been on Bay St. Louis and OBGYN board certified for 15 years. My family had a camp on the Gulf Coast and thought it would be a great place to have a practice.
So you moved here after Katrina?
Before Katrina.
Before Katrina. Okay, yep. And it didn't run you off?
Didn't run me off.
Okay. Now, we're going to talk about a subject today, as I mentioned at the beginning. This is kind of a very sensitive issue for women. So what we would like to do is we're going to move into another more comfortable room that the ladies like, as you said, and talk about a procedure called the Mona Lisa Touch. Dr. Duplanchet, what exactly is the Mona Lisa Touch? I mean, I understand it's been around just a short period of time.
Yes, it's a new technology. It's a laser that promotes a thermal injury to the vaginal tissue, which in turn promotes the tissue to revitalize some of the proteins that are lost during the menopause period, like glycogen, fibrin, collagen, elastin. These proteins are reformed and it makes the tissue a more healthy, viable tissue.
Now, you said women that are going through menopause, so a woman in her 30s, 20s, something like that, probably not something they have to worry about right now.
Not right now. Some ladies do, younger girls do have some special conditions that this also treats, but this is more aimed towards ladies in their menopause years who are perimenopausal or in menopause.
So, I mean, what kind of symptoms are they starting to experience that they would consider doing something like this?
These ladies are complaining of vaginal pain, itching, burning. They complain of painful intercourse, and sometimes they have painful urination. And this treatment helps with those conditions.
So what exactly, I mean, what do you do, the procedure? Tell us about that.
The procedure it's a 5-minute procedure. It's painless.
Wow.
It requires no anesthesia. You can basically do it during your lunch hour if you have a lunch hour. And it's a probe that gets inserted into the vaginal canal, and it produces a laser in a circumferential type manner.
It's a cold laser, you said.
It's a CO2 laser,
CO2,
fractional laser.
okay.
And it's painless, and you go 3 treatments 6 weeks apart, and ladies are saying it's life-changing. They've been really happy with the results.
And you're doing that procedure here?
Here at Hancock Women's Center, yes. And so there's not very many lasers available in this area. In fact, I'm the only person doing it on the Gulf Coast.
Really?
At this time.
Now it is it's relatively common, I guess, commonly available to consumers to come here to get it done? Yes,
all they need to do is call our office or visit our website, and they're able to make an appointment anytime. And you know, we kind of keep my regular patients that are, you know, OBs and, you know, a lot of what's going on in the front office. We have a private waiting room, so it keeps the patients in a private setting.
So, and this is where we are right now. This is kind of this is nice.
It's like a little private sanctuary.
Yeah, we guys don't get stuff like this. I mean,
it's nice, smells good.
I noticed
quiet.
there was a coffee pot, a teapot in there, you know, a little coffee machine, so you can come in and sit and relax.
Almost like a spa experience.
That's a good way to put it.
It's nice. It's nice.
Spa's done on the outside of the body, and well, okay.
The husbands like to sit back here too. The husbands like to come and wait back here.
Well, I can understand that, but the way you put it, though, it's not a seriously terrible procedure.
It's relatively painless. I mean, when we do the external treatment, there's an internal treatment and an external treatment. We do use some Emla cream, which is a numbing cream, but patients tolerate the procedure very well. They're able to go back to their afternoon activities with no problem whatsoever.
They did some clinical studies on this.
They did. Dr. Karam, Mickey Karam, he is at the Cleveland Clinic. He was one of the He's one of the pelvic organ guys. Premier, yeah. And he did the studies, these pilot studies, and basically they took patients and did histological studies, like where they looked under a microscope at the tissue, and then repeated the studies 2 weeks after the second treatment. And it really is amazing some of the what the changes are. The tissue goes from super thin to normal vaginal tissue, pre-menopausal vaginal tissue.
Really?
Yes. And he was really promoting it. I actually saw his first talk about the Mona Lisa Touch at a conference in Las Vegas, and if he was promoting it, I was like, this is the real deal. So it was very impressive.
So that's why you decided
That's why I decided. I didn't think it was a gimmick.
And it's a fairly simple looking little machine.
Yeah, it's a little laser, basically the same type of technology that you use for aesthetics for your face.
Yeah.
It's the same type
It's
of
just
technology.
internal aesthetics.
It's just internal, but it promotes the collagen growth just like on your face.
Right,
Same
right.
type of tissue.
What about breast cancer patients? Do you find a lot of those that are having to deal with this kind of issue with as far as the vaginal problems that this will help?
Yes, the traditional treatment is estrogen replacement, vaginal estrogen, and patients with breast cancer who have a contraindication to estrogen therapy were really left with no treatment whatsoever. So this is basically, the best patient would be a breast cancer survivor who is in the category where they're not able to use estrogen as an option.
Okay.
Or women who don't want to use estrogen as an option. Some of the times the creams, patients say the creams are messy, they forget to use it, it's not spontaneous. They just have a lot of reasons why they want to do this and be done with it.
Now, I know this is a relatively new procedure here in the States. Longevity.
The treatments last, the ongoing studies that they have right now in Italy, the ladies are 2 to 3 years out, and they're asking for a maintenance treatment at that time, really not because they're back where they were, but they don't want to get back there.
Get back to where they were.
Get back to where they were. They want to keep the tissue as healthy as it's been.
We have less than a minute left. What if people want, women want some information on it? What do they need to do? Just call you here?
You can call me here at Hancock Women's Center, or you can.
Do they need a referral from their general practitioner?
They do not. They could just call. The website is hancockwomencenter.com. My office number is 228-467-2555. We're in Bay St. Louis, right next to Hancock Medical Center.
Right.
And we'd love to hear from you guys.
If you turn right there by the Wendy's and go north on that street, you'll see it right there. So thank you so much.
Thank you so much.
Very educational.
Thank you.
Ladies, is this something that may help you out with that problem? Find out more about the Mona Lisa Touch. Give them a call.